Hello. In this video we're going to look at the process for following up non-attenders, or patients who don't get their blood tested when they've been asked to. We're going to be using the acronym DNA, which stands for Did Not Attend. And attendance in this context means attendance of their phlebotomy appointment. We're not talking about consultancies here, just having their bloods tested. We'll start by considering what we call tolerance intervals or grace periods and how those are applied in Dawn. We'll then learn how to DNA a patient or record the fact that they missed their blood tests. And then we'll run through an example DNA workflow. Now this is entirely configurable, so what you're going to see is just an example of what you could do. And in this example, we're going to give the patient 2 chances to have the bloods done. The first time they miss, we'll send them an SMS reminder. Now that could be an email, that could be a phone call, that could be a formal letter, that can be whatever you want. But in our example, we're going to do an SMS reminder. Failing that, if they fail to have their bloods done again, we're going to send a formal letter, and we're actually going to copy that to the GP by email. And if again they fail to have their bloods done, we're going to put their prescription on hold. And in Dawn, that means actually suspending their treatment plan for non-attendance, and that will trigger a different letter, a suspension letter, and again we will copy that to the GP. Once we've considered patients who have missed all of their tests, we're going to think how to deal with patients who have some tests but not all. So they might have a full blood count but no UNEs. But let's start by considering what we call a tolerance interval. A tolerance interval is an interval which we apply either side of the due date for the test results. And what that does is create a window of acceptability. Test results received at any point within that window are valid. If they're received before that window, they're really a little too early. If you see somebody at a 2 or 3 month interval and they have their bloods done again a week after you've seen them, they might actually not be all that relevant. They're going to be similar to what you've seen before. You really want them tested later. But after that whole window has expired, if you still haven't received a result, then you're going to treat them as a non-attender and follow them up. Now, tolerance intervals are proportional to the normal test interval that the patient is on. So if you're seeing somebody every week, they'll have a tolerance of 5 days. If you're seeing them every 2 weeks, they'll have a tolerance of 7 days. If you're seeing them up to a month, they'll have a tolerance of 10 days, and over a month, they'll have a tolerance of 14 days. Older configurations actually have 28, but we can change that. If you want to bring that down to 14, if you want to extend it to 28, that is possible. It's perhaps easiest to understand tolerance if we look at it in the context of a linear timeline. So this patient is on an 8-week normal test interval. This is when they had their last test done. And then after 8 weeks, this is where the next tests are due. If they fail to have those done, they have a tolerance of 2 weeks. So that means any point during this period is acceptable. They don't have to have them done right on that date. But if they don't have them done at all within that tolerance interval, or grace period if you like, we're going to trigger a reminder. We're going to DNA the patient, record the fact they didn't attend once, and trigger a reminder. And in the example I'm going to show you, that's going to take the form of an SMS message. We're going to move their test date on for another 2 weeks, or it could be a week, it can be whatever you want. But if they still fail to have their test results done by that amended date, we're going to trigger a second reminder, and that's going to be stronger, and in our example it's going to take the form of a formal letter. Again, we'll move the test date on, giving them another 2 weeks, or another week if you wish. But if they fail to have the test done for a third time, we're actually going to suspend their prescription, put their treatment plan on hold, and generate a suspension letter to both the patient and the GP. So let's see our example process in action. As with everything in Dawn, your starting point is the home page and this dashboard panel for the work list. And today what we're interested in is the number of patients who are late for monitoring tests. Okay, and we have some, we have 10 in fact, and to find out who they are, we click this link and it takes us to the non-attendance list view with the late filter selected. You'll see the list is divided into 2 groupings, and in this top grouping it says the last visit was not closed but all test groups are now overdue. Now what that means is something I'll come back to later, so we'll consider these 2 patients in a while. The more normal scenario is this one, where the patient has a visit, a current open visit, which is due, but they have no results yet. So let's start by looking at one of these patients. Now everything to do with non-attendance we handle from the Interventions tab. And here I can see that Francis was due to have his test done on the 8th. He's on a 4-week normal appointment, which would give a tolerance of 10 days. And let's look at that on the calendar. Here we are today. He was due here. That's 7, 8, 9, 10 days have elapsed. So his tolerance period has expired. And today is the first day he's appearing on the non-attendance list. Now to record the fact he's missed his tests, we press this DNA button over here, which is going to increment his DNA count. You can see that shown at the top here. It's now showing as 1. And we've got a message here reminding us to move his test date forward. So we're on the 19th. In his case, I think it's okay to put him on another couple of weeks. So that's what I'll do. And the final step is to schedule that, which kind of confirms it. And at that point, it's going to automatically trigger an SMS text message to him. And to have a look at what that says, I can look at the Letters tab and I can see there's a blood test reminder. And that's going to say, "Dear Francis, your blood tests are now due. Routine blood tests are important to keep you safe and ensure your medication is appropriate. Please arrange to have your blood tested as soon as possible from the rheumatology team." So nice, polite reminder. And now, if we return to the non-attendance list, Francis is no longer on it because we moved his test date forward, so he isn't late anymore. But on that record, we have recorded that he's failed to attend once. And I can actually see this DNA count on the list view as well. And so I can actually see, well, there are some people where this will be their first non-attendance. There are some who've DNA'd twice or once before. So let's click on this patient, Digby. And if we go to his Interventions tab, again I can see that he's already on a DNA 1. We've already sent 1 reminder to him and he's failed to have his test done. He's now overdue again. He's on a 2-week appointment, but that date's yesterday. And that's important because the tolerance period is only applied once. That's your first chance to have your test done within the tolerance period. Once you step outside of that and you've been DNA'd at least once, then whatever date you move the patient onto, as soon as that is passed, they appear back on the list. So he was due yesterday, he didn't come, and so straight away he appears back on the non-attendance list. The process for dealing with him is the same. We press the DNA button. That's going to ask us to move the test forward again. In his case, because he's only on a 2-week interval anyway, I'm just going to move him on a week. And again, I press schedule to kind of confirm that and trigger the reminder. And in this case, it's not an SMS text message, it's now a formal letter, which is going to automatically print out on my printer and I will put in the post. That's what it means by mail. But it's also been copied to his GP, Dr. Dawn, and that's going by email, or email with a PDF attachment. And to see what those look like, again, I can look on the Letters tab. There's actually only one instance here, but it has 2 recipients. There's the patient and there's the doctor. But the message looks like this, and again, this is entirely configurable. It's just an example, but this can have your header on and your logo and extra information and slightly more strongly worded text. Despite our recent reminder, we are yet to receive blood tests. Please arrange these as soon as possible. And then kind of some indication what will happen if you don't have your results done. If we do not receive new results in the next few days, we will be forced to put your prescription on hold. Hopefully that will do the trick and Digby will now attend. If he doesn't, he will appear back on this list the day after he was due. But I can see also, if I look at this list, I do have some people, like Belinda here, who've already been sent both reminders, and yet in spite of those 2 reminders, she still failed to have any test performed. We have no results for her. That rescheduled test, rescheduled for the 2nd time, is now passed. So what we do simply is press the DNA button again, but Dawn has different rules once the DNA count has reached 2. This time, it's not prompting us to move the date on, and instead of a reminder letter, it's generating a prescription on hold letter, which again is going to the patient by mail, so it's to print out for posting, and to her GP by email. It also tells me that the treatment plan has been set to non-attending. This is akin to a suspended status, but for a specific reason, and that reason being that they keep failing to have their blood tests done. This just allows you a little period of time in which the patient or the GP could get back in touch and give a reason as to why that was the case, or potentially you might actually get those results in, they might be in the lab now, in which case you can come back into the treatment plan and you can reactivate Belinda. However, if the GP is in concordance, or the patient is either a serial non-attender, or there's some reason why they can't get the blood tested very easily, and you agree it's not safe to continue on this course of treatment, you can simply press the stop button here to say that the therapy is finished. Let's have a quick look at the letter it generated. That's this prescription on hold letter, again copied to the GP by email, and similarly that's nicely laid out for printing, but it has different text in it. Unfortunately, this means we'll have to put your prescription on hold. If you have had your bloods tested, or there is a reason why you've not been able to do this, please contact us as soon as possible. Again, the wording can be whatever you like. But there we have 3 examples. Somebody who fails to attend the first time, their tolerance period is up, and we send them a gentle reminder. We reschedule an appointment. They still fail to have the blood test done. We sent them a slightly stronger reminder by a formal letter this time, and copy it to the GP. And if on the third time they still fail to have the results done, we suspend their prescriptions, mark the treatment plan as non-attending, and send them a prescription on hold letter, again copying it to GP. Now, as I said before at the beginning, this as it is an example workflow, you can tailor that, how many chances they have, what kind of correspondence and to whom, and what wording that contains, and whether it's by SMS or email or a phone call or a formal letter. That's entirely up to you, and we can work with you to set that up. There is, however, one last scenario to consider, and that's these patients at the top, whereas Dawn's saying not that they have no results, but their last visit was not closed and all the test groups are now overdue. So something's been missed with these patients basically. They were due back in August, and in fact they got a full set of test results. But they were watchful wait, so Dawn didn't move them on automatically, and we've missed a step in our process and not actually closed that visit. Had we done, we'd have moved them forward by 12 weeks, as that's their normal interval, which would have taken us roughly to the middle of October. So that time is now up, that's now passed, and a grace period of 4 weeks is also up. So Dawn is saying really this patient should have had a new set of results by now, and you should be treating them as a non-attender. So the system is compensating for the fact that we missed a step, and it's recognising this patient is now overdue for a new set of results, and that's why they're appearing on the DNA list. The only problem is I can't DNA them because they've got a full set of results. So what I can do is do what I should have done in the first place back in August and close this set of results. Now to do that I do need a next result date, but what I'm going to do is put it roughly, I don't know what it would have been, it would have been something around here. It doesn't really matter because we're going to DNA them. But if we close the results now, Dawn has set up what would have been their next test. That's the one they're now overdue for, so we can press the DNA button, move the date forward from there. We're here now, so move them on a couple and press schedule. And there we go. They get their blood test reminder and their DNA count has been incremented. And it would be the same process with Eric here. So the DNA process doesn't only include patients who just have no results. It does look back. Anybody who was missed and whose visit wasn't closed and who's now overdue for a new set will also appear in here.